Well, good afternoon. I'm here to update you on another significant development in relation to our COVID state of emergency in Western Australia. Because of a rapidly developing situation in Victoria, Western Australia has changed the border arrangements with Victoria, which has now moved from very low risk to low risk. This means that travellers from Victoria will now be subject to restrictions on entry into Western Australia, effective immediately. People arriving from Victoria can still enter Western Australia, but they will all need to self-quarantine at suitable premises for 14 days. They'll also be required to undertake COVID testing on arrival or within 48 hours of arrival, and a second test at day 11. The situation in New South Wales continues to affect other jurisdictions, so we are now seeing cases emerging in Victoria. We see how quickly this virus can spread in the case of the removalists who travelled from New South Wales through Victoria and onto South Australia. We have to assume that this is the more contagious Delta variant, which requires our immediate action. There are now reports of 2 separate clusters in Victoria involving a rising number of cases. The list of exposure sites in Victoria is growing, and so is our concern and the risk to Western Australians. Victoria joins ACT as a low-risk jurisdiction, while New South Wales and Queensland remain at medium risk. All other jurisdictions, including New Zealand, remain at very low risk. However, there are some exposure sites for Tasmania and South Australia. We ask anyone who is travelling into Western Australia to check regularly to see if they may have been in one of those exposure sites and follow the directions accordingly. This change to the Victorian border arrangements comes just days after it was opened as a very low-risk jurisdiction. This is the nature of this disease. Things can and do change suddenly, and we need to respond accordingly. We realise that this development will have caught many travellers off guard, and there are people arriving today to a very different set of conditions than they were expecting. Some are still flying here as I speak. This includes the Geelong Football Club, who are arriving now for a match against Fremantle tomorrow night. At this stage, the match can still go ahead with strict protocols that the Chief Health Officer and I have discussed. That will mean that the players go straight into isolation and get tested tonight. Those test results will also be known before the game starts. Under these conditions, we can still allow a crowd at the football match tomorrow, and that's good news. It is the result of a very well-disciplined set of conditions that we have established with the AFL over the past season. The AFL imposes its own COVID testing regime on players and staff, and we're confident that those processes will continue to serve everyone well. We know that when we make these decisions affecting people's travel across Australia and into WA, that they have an immediate and significant impact on people's lives, particularly those with family on the eastern seaboard, people in the middle of school holidays who may have travelled. But again, we're not discriminating against people, we're discriminating against the virus. And we will do everything we can to prevent the disease impacting on Western Australia. As we've seen in New South Wales, situations like the one that's unfolding in Victoria often does get worse before it gets better. I remind all travellers that they need an approved G2G pass, and in many cases those approvals will need to be updated as conditions change. You will receive messaging on your G2G app, and I ask that you check that if you're subject to existing G2G approvals. Thank you. Ready to take some questions.
What's the reasoning around Geelong players being able to still go ahead of this match under isolation conditions, effectively a bubble? Is it because the playing field is not considered an exposure site at the MCG, or the Optus Stadium playing field being separate to fans?
So we've worked very closely with the AFL. The Geelong players and officials will go straight from the airport into a secure quarantine arrangement at their hotel. They will then be transported in a secure way to Optus, and whether they are in training within the rooms themselves and on the playing surface, they will be under very strict quarantine arrangements, as will all other officials that travel with them. We're very confident that the AFL have, in addition to the conditions that the Chief Health Officer and I as the State Emergency Coordinator put into place, they've been very well disciplined. We've not seen any difficulties in their adherence to our requirements. So we're very confident that the arrangements are safe. If they were not so, then certainly the Chief Health Officer would tell me, and we would make a change accordingly. But we're confident that the AFL have got very good arrangements, and in fact they put conditions over and above what we in fact put in place.
What does this mean for the Dockers though? Because obviously they will potentially...
I'll just take this one first, Jess.
Yeah, what's the protocol for Fremantle then? Because obviously they will tackle each other during the game.
Yeah, so it is being conducted under quarantine conditions, and again, on the public health advice, the Fremantle players will of course be subject to testing themselves, but subject to the match going ahead and no issues, accepting that we'll have results before the game starts to know that there are not any infectious players, then they'll be in a condition where both the state and the AFL will require the Fremantle players to undertake further testing. So we're confident that those arrangements will make sure that it's in a safe environment.
Will they have to isolate after the game, Fremantle players?
We'll make that assessment, but at this stage they will be able to go about their normal business because they would have been subject to testing arrangements to make sure that no player is infectious.
Right, so this may be a question for the Chief Health Officer, but why the blanket rule for people coming back from Victoria? I mean, there's a bit of a discrepancy there. Even people that were at the MCG but not sitting in that one spot in Victoria, under their rules, their Tier 3, all they have to do is monitor their symptoms. But for everyone else that's coming back here, it's 14 days, regardless of where you were sitting.
So we have always adopted the situation in these like circumstances to treat the whole state or territory as a single approach, because it is not just the MCG that we're concerned about. There are emerging situations, 2 known clusters where people have been in contact with infected people. They've been out and about in the community at places such as shopping centres. They've been going to hotels and other licensed premises. That gives us rise for concern that this is not just confined to a certain section of the MCG. So that's why we've had to treat the situation that has evolved as a concern. It is not yet, and one would hope it doesn't go to medium status, but it's of sufficient concern that the Chief Health Officer has advised that this is of such concern that we need to escalate it as an entire state, because these people who have been infected have been moving about in the community.
How close are we to going to medium status? Are you back on?
Well, we're not at this point. So again, we'll be monitoring the situation, and you know, we had a emergency management team this morning. I've briefed the Premier twice today. This is a situation which we will continually monitor, and the Chief Health Officer can no doubt elaborate further on that.
Commissioner, those flights on their way to Perth right now from Melbourne, what's awaiting the people on those planes when they get to the airport?
So they'll be advised both on their smartphone devices, but on arrival they'll be advised before they disembark the plane what the changing situation is. We routinely ask a police officer to go on board the aircraft. We clearly advise them about the situation. They will then not only be screened as they come in through the airport to make sure that they're eligible to come in, but certainly they'll also receive a health check, and there's a COVID testing clinic available, and the Department of Health have put that in place at both the domestic airport and the international airport. They can get tested immediately, and or the directions that I've signed do require, if they can't get tested immediately for some other reason, they have to get tested within 48 hours.
Commissioner, where are the Premier and the Health Minister right now?
Well, the Premier's on approved leave, as indeed is the Deputy Premier, but look, he's been present at every emergency management team briefing, and as I say, I've briefed the Premier with the Chief Health Officer regularly this morning, and I again spoke to him this afternoon.
Given the escalating concern, as you put it, about the nationwide COVID situation at the moment and the tightening of the exemption criteria for medium risk New South Wales, what's the advice at the moment for people leaving WA to go to Victoria? And if that advice is to not go for holidays, to even reconsider work travel, then why is football still considered different and travel in and out of states still permitted for footballers?
Look, I realise that there's a lot of public interest about footballers, but they are professional workers, if we put it in that category. They were in the air when these decisions were made, and as I said earlier, as an industry, the AFL have worked very closely with both Department of Health and Police. We're very confident that as an industry, they have been very professional and diligent in the way in which they've cooperated with Health and Police and others, but they've actually put in an extra layer of discipline around that. And you've seen where they've fined players and officials who haven't kept to the additional protocols they put in place. So we're very confident that they are a very disciplined, professional industry that have done, I'm not saying they're free of any wrinkles or issues, they do arise in every industry, but we're very confident that they have that in place. So they do that as a job. We can't treat them the same as a community club of footballers that are simply going on some social outing, because that's their day and night job. So on that part. On the earlier matter, I would strongly ask people that are intending to travel to Victoria or any of the other places, and obviously that includes New South Wales. By law, I can't prevent Western Australians leaving WA. The law just doesn't provide for that. So people are at liberty to go, but I suggest people to really strongly assess and consider, do they need to go? Is there an absolute necessity for you to go? If you're intending to holiday, then you do run the risk of being in a state which may in fact have additional restrictions on you re-entering Western Australia. So at this moment in time, it's very difficult. I've been caught up in that situation myself, that you have to make an assessment. Is it critical and necessary that you go in the first place? And secondly, you need to be adaptive to the changing environment. We don't do this, because we want to. We're doing this to protect all people, including those that must travel.
Commissioner, I guess they're, Geelong are in the air, like you say. They're also probably returning Western Australians that are also in the air, and they might land and think, well, Geelong can play and I'll put it on quarantine for 14 days.
Well, the Geelong players will be in quarantine themselves. So they will be not allowed to be out and about in the community. They'll be going straight to a quarantine hotel, and they'll be on a playing service and in a very strict controlled environment. They will not be permitted to go out and about like everyone else.
Commissioner, could you or Dr. Robertson confirm, is there a train driver and 3 crew members isolating in a Perth hotel after they were at the same service station and cafe as those 2 removalists from New South Wales who travelled through South Australia?
I don't have that information, but Dr. Robertson, who's following me, may have that information.
Just lastly on the football, is there any requirement or recommendation for fans tomorrow night to wear masks?
No, there's not. We are in a situation which is very privileged. No one's required to wear masks. However, I know that Dr. Robertson has advised on this many times. People should take whatever precaution they should. It's in a densely crowded situation, and I see, and I think everyone does see, people who are going about their normal business, whether they be at their place of work, shops, transport, that are wearing masks as a routine protection. That's wise, but there's certainly no lawful direction that they must at the moment.
Could you tell us about the 2 people kicked out of WA after making false G2G declarations?
So in the Kimberley, we've had a situation where numbers of people have been unable to travel into WA for a period of time when we had certain conditions to the Northern Territory. Those conditions were lifted at 1 minute past midnight on Monday. But what we have had are two situations where two individuals have been denied entry on their GTG application because the information was that they'd both been, these are two individuals not travelling together, been in New South Wales. In both instances, it's alleged that they have reapplied the GTG application, but they've not declared that they've been in New South Wales, unlike earlier applications. So once that was uncovered, and we monitor every person coming in, we have discovered, and it's alleged that they have not declared truthfully the situation. So both persons have been escorted out of Western Australia, and investigations will continue with that. I might remind, as a general remark, that a man was jailed for 7 months by the courts for breaching the Emergency Management Act directions. So we must and do treat these very seriously. If people are prepared to break the law, to falsify applications, you run the risk of up to $50,000 fine or imprisonment. So these are very serious situations, and we cannot have the situation where amongst the thousands of people that come back and forth across our borders that people can falsify. They can't, and you run the risk of a criminal conviction and imprisonment.
That G2G system, is every application seen by a real person, or are there some automatically denied by the computer system?
No, I've got a real person behind every application. So we assess every single application.
Commissioner, just touch on New South Wales for a moment. We've got a case where there's a West Australian mother who's stuck over there. She lives about 10 hours away from any of the clusters and has children over here in Western Australia as young as 10 years old. She can't get home. Is there any compassionate grounds where in a case like this someone can come back? Or
we do assess individual cases on compassionate grounds, and certainly Dr Robertson and I get those every day and have for the last 16 months. So any person that has a compassionate claim that has been denied, they are certainly able to again resubmit and ask for reconsideration. So in that situation, I'd advise any person in that situation to ask for some reconsideration. But if it doesn't fall within the rules, then look, it's a sad situation for many people, and people have to adjust. But I would certainly invite the individual situation you've spoken about to reapply if she hasn't already.
Similar to that case, the main frustration I'm hearing is people who are actually hundreds of kilometres away from Sydney in any confirmed cases, and yet being denied G2G passes on the grounds of the new tougher interpretation of the compassionate exemption, even though they're WA residents. Is there leeway there? It does seem to have become a hard and fast.
No, that's the approach we've generally adopted right from the start of this pandemic. The difficulty in taking the word of an individual, they may well be absolutely truthful in what they've said. What none of us know is who have they come into contact with, and the community in which they've operated or moved about in, or the things that they've touched, or the transport by which they've gone there. Has there been an infected person in a particular place that the others don't know about? So we've seen many, many instances throughout this pandemic where individuals have unwittingly gone about their normal business, no fault of theirs, but they've unknowingly come into contact with an infected person. That's what this whole response is all about, is making sure, based on public health advice, that we provide the best possible protection to Western Australia. And I think the approach we've done is borne out by the lack of community infections that we've seen here in WA.
But can't 14 days quarantine for those people who sign applications stating they haven't been anywhere near Sydney, can't 14 days quarantine ensure that risk is minimised enough?
It's rarely that we've been able to provide any exceptions to that. There are many, many thousands of people, thousands of people per week that do that. Some of this does rely clearly on trust, but that's in response to the earlier question, is if people falsify these, and I'm not suggesting that your inquiry is based on that premise, but none of us should be surprised that at times people lie. But the highest threshold that we have to take here is what is safest for the community. And yes, Australia is a big country by geography, but what we can't do is have great certainty in any particular place And I think you've seen, without me being overly critical about Sydney, where a cluster started in Bondi has now rapidly spread across a city of 5 million people. But in regional areas, we've also seen clusters emerge, and clearly one's happened in Goulburn. So, you know, your proposition would be, why can't people from Goulburn come into WA? Well, we've now seen a traveller go to Goulburn. So that's the approach that we've taken it, but we base this on public health advice.
In New South Wales, we've seen multiple breaches of COVID restrictions, people having parties in hotels and all sorts of things. As far as I understand, we didn't deal with that level of indiscretion here in Western Australia. Why do you think that is?
Look, we've adopted an approach from day one about policing by consent, and I've certainly given instructions to the police here that we would rather give out a mask than give out an infringement. And I think that's penetrated the public consciousness to go, well, the police aren't here just to fine us, they're here to work with us. And I think that is a proper approach to take, because when the community of Western Australia understand that we're doing it for their protection, they'll come with us as opposed to police at them. And I think that is actually one of the differences. Okay, thanks very much.
Dr. Robertson. Were you aware of that train driver?
No, I wasn't. So I'd need to check that just to validate that. It may be correct, but we do get quite a few rumours of these kind of events.
How close did you come to reinstating a hard border or the medium risk category for Victoria?
At this stage, based on the current situation, we felt that low was at the appropriate level. We didn't think that it warranted a medium border at this stage. However, we are very cognizant that the situation may change. While there has been a limited number of cases, particularly in the Maribyrnong apartments, we are aware that the people within those apartments particularly have been out and about in the community, including at the Melbourne cricket ground, including at a number of shopping centres, and that they have a number of family members and friends outside they've been in contact with. So it will really depend over the next 24, 48 hours as to whether the spread has been contained or whether it is more widespread.
Given that, and given the terminology news that the football's got the go-ahead with the crowd at this stage, how close have you come? Is it still on the cards that that match tomorrow night could be cancelled or without a crowd?
I think it's unlikely that it'll be cancelled or without a crowd at this stage. I think we, as part of our arrangements that we brought in on Monday, we're requiring anybody who's been at a venue of concern to, and that's been occurring since Monday, to actually to be tested and to quarantine for 14 days, and that's jumping on this problem quite early. I mean, we literally only found out that the guy was tested on the 11th and he'd been travelling on the 8th. So we are actually quite early on in this outbreak. So that is to our advantage, and I think, and obviously the Victorian Government and the Victorian Department of Health and Human Services are making sure that they lock down that area, do the testing, do the contact tracing that's required.
The Sydney lockdown, we've seen it become progressively tighter over time, and there are suggestions from various epidemiologists that it's still not tight enough to bring the current outbreak under control. What's your view on the restrictions currently in Sydney? Should they be harsher or are they good enough?
Our approach is obviously to have a very tight lockdown and to do it early, and hopefully to minimise that. But we have to adjust that approach depending on the situation. So that's what obviously the New South Wales Health has been doing, and obviously providing that advice to their government.
You've previously said, I think it was that 80% of the population would need to be vaccinated before interstate borders can lift. Is that still the case?
Look, I think the 80% is obviously an estimate, but what 80% signifies is that at that stage we would estimate that most people will have been offered the vaccine. 80% around that area, the modelling would suggest that that if we have that kind of percentage. If we do get an outbreak at that stage, it's unlikely to rapidly escalate like we're seeing in Sydney. We might still get a few cases, and we may get a few people who are unwell. But we'd also like to see that in the more vulnerable groups, those over 70 and those over 80 are at least 80% and preferably a lot higher.
Based on what we're seeing in New South Wales, a hard border with the state, what are we looking at, September or?
Look, it's going to take some time. I mean, we're still seeing that they had 97 cases today. They've still got 24 who were in the community or fully in the community, and some who are partially in the community. So it will take time for that, for them to get to the peak of this and for it then to play out. Given we also require 14 days of no community cases before we would consider getting back to a very low risk, I think that will probably take us through August probably into September.
How far off reaching that 80% vaccination target do you think we are in WA?
Oh, I think we're at this stage. The first doses, we're sitting at I think around 30%. The second doses around 10%. Obviously, there's a bit of a lag there because of the AstraZeneca and the 12-week requirement, but that will escalate, and we're seeing, as the Commonwealth has been indicating, there will be a ramping up of doses over the next month, and that will increase further in September and October. So, look, I think we're in a good place with a good solid base to build on that and to proceed. So I think we can get to 80% by the end of the year. It'll obviously take some hard work, but I think the things are falling in place for us to do that.
Are you concerned about the vaccination rates among 60 to 69-year-olds specifically, who are only eligible for AstraZeneca at this point? I think something like 54% have had a first dose, and I don't think there are very many bookings in that cohort either.
So all of the groups we are looking at, certainly that is one of the groups that we will need to continue to work with to work through on the AstraZeneca, what their concerns are and how we best can encourage them to get those doses. But we appreciate that will take a bit of work.
Is there a vaccination level where snap lockdowns will no longer be a feature in Western Australia? Is that 80% too?
I think you're moving again towards that, without speculating too much here. We need to get to a stage where we're confident that the population has been offered the vaccine, that if we do get an outbreak, that it's not going to become a major outbreak which could lead to serious numbers of people who are in hospital. And we're seeing this to a degree in New South Wales. I think it's now 71 who are in hospital. A number of people who are in intensive care, including some as young as 17, and that's obviously something that we don't want. We'd want to avoid, and to do that we need to get that vaccination rates up to those kind of levels before we consider not requiring lockdowns or some other restrictions.
Can you explain, please, the tightening of the compassionate exemption for G2G arrivals from New South Wales? What's the standard now for extenuating circumstances for people to come home? What do they need to prove?
It's obviously done on a case-by-case basis. As the Commissioner has said, we will look at each case, but it would normally be something that a family member who is seriously ill, a situation where one of the family members may be at the end of their life, might be a spouse who is in childbirth. It could be one of those serious things. I think that the more critical thing is just encouraging people, this is not the time to travel to New South Wales.
But there are people already there.
There are.
No fault of their own got caught there.
But that's right, and we will consider each of those on a case-by-case basis. So, but if people have just have gone over for a holiday or have gone for work or have gone to play sport, they may not be able to get back. But we do appreciate that people have gone. For example, one of the ones that has come to me recently is somebody who went over to care for a very sick relative. They've been there for a number of months. They're now coming back. Obviously, this wasn't something that it wasn't a holiday. It wasn't similar, and obviously they're the kind of cases that we will consider to bring back compassionately.
We've spoken with people in Sydney who are parents and they're now separated from their children in Perth. Is that circumstance something that's likely to warrant an exemption?
Again, we'd have to look at the circumstances, what their care arrangements are currently for the children, and what the circumstances are. It's very hard to say, yes, we would do it on this circumstance and not on that circumstance. It is very much a case-by-case situation, and as the Commissioner has said, we look at these every day, we consider them every day, but we were strongly encouraging people not to travel to New South Wales, not to travel to Queensland, not to travel to Victoria at this stage, because there is a possibility that they may get trapped there and may not be able to return.
So just lastly on Victoria, given the context of more exposure sites being added and the apparent reluctance of the removalists being interviewed by contact tracers, are there any numbers around how many people have arrived from Victoria in the past 24, 48 hours before the 14-day quarantine rule kicked in?
Look, I think we do have some numbers, and it might be more of a question to ask the Police Commissioner on the exact numbers. I think it is around over the last 5 days, I think 4,200 over since Friday. So that gives you an idea of how many people have come in since Friday. Obviously, the numbers we would anticipate as the directions come in that those numbers will drop off.
I guess what would you say to those Victorians that are landing that have to go into quarantine and they understand that Geelong is going to go ahead and play? What's your message for those people that have to go into quarantine here?
Well, the message is that everybody's going into quarantine. It doesn't matter whether you're a football player, it doesn't matter whether you're another sports person, it doesn't matter if you work as a FIFO worker or you're here for a holiday. Everybody will be going into some form of quarantine, and as the Commissioner said, we've worked very closely with the AFL to make sure that they have very robust quarantine arrangements. We've been working with them for nearly 15 months now to make sure through a whole range of different lockdowns, different shutdowns, and not only our borders going up, but other states' borders going up.
They're in quarantine, but they can tackle opposition players who then don't have to quarantine.
But they are required to be negatively tested. They'll be tested. The risk of actually getting infected in an open arena outside is very low. We know that. There's almost no cases that have been recorded with people spreading it in an open arena outside.
So you would happily sit in that crowd tomorrow night without a mask?
Yes, I would, but I appreciate people. There'll be a lot of other people there, and they may like to wear a mask, and we would not discourage people from wearing masks. If they're feeling more comfortable in a large crowd, then we certainly encourage them. But the risk from the team is very low.
Thanks, everyone. We're better off.